If you're over 60, listen closely, because what I'm about to tell you could save your life. Right now, someone just like you is walking around completely healthy. No pain, no symptoms, feeling perfectly fine. But inside their body, a silent killer is already growing. It's called pancreatic cancer. And it's one of the deadliest cancers on Earth, with a survival rate so low that doctors call it the cancer that hides in plain sight. By the time most people feel something is wrong, it's often too late. But here's what almost nobody knows. Your body actually gives warning signs weeks, even months before diagnosis. Today, I'm going to show you exactly what to watch for before it's too late. Hi, I'm Dr. William Lee. As a physician and researcher dedicated to helping people live longer, healthier lives, I've studied cancer prevention for years. Today, I'll share critical facts about pancreatic cancer every person over 60 needs to know, before symptoms even appear. So, what exactly is pancreatic cancer? Your pancreas is a small, banana-shaped organ tucked deep behind your stomach. It plays two critical roles. It produces enzymes that help you digest food, and it makes insulin, the hormone that controls your blood sugar. But here's the problem. Because the pancreas sits so deep inside your abdomen, surrounded by other organs, it's almost impossible to feel or examine directly. There's no simple blood test, no routine screening that catches it early, unlike breast cancer or colon cancer, where regular checkups can find tumors before they spread. This is exactly why doctors call pancreatic cancer the silent killer. It grows quietly, often without causing any noticeable pain or discomfort in its early stages. By the time symptoms finally show up, the cancer has frequently already spread to nearby organs, like the liver or lungs. In fact, nearly 80% of pancreatic cancer cases are diagnosed at an advanced stage, when treatment options become far more limited. This is why understanding the subtle, early warning signs, the ones we're about to cover, is so incredibly important, especially if you're over 60, when your risk rises significantly. Awareness truly can be the difference between early treatment and a late-stage diagnosis. Let's talk numbers, because they're eye-opening. Studies show that nearly 90% of pancreatic cancer cases occur in people over the age of 55, with risk climbing sharply after 60 and peaking between ages 65 and 74. The average age at diagnosis is around 70 years old. Globally, pancreatic cancer ranks among the top causes of cancer-related deaths, despite being far less common than cancers like breast or lung cancer. Why? Because its 5-year survival rate remains one of the lowest of all major cancers, largely due to late detection. Men have a slightly higher risk than women, and the risk continues rising with each passing decade after 60. If you're in this age group, these numbers aren't meant to scare you. They're meant to make you pay closer attention to your body, because early detection genuinely changes outcomes. Now let's answer the question in our title. Why exactly is pancreatic cancer so deadly? First, location. The pancreas is buried deep in the abdomen, hidden behind the stomach, intestines, and other organs, making tumors nearly impossible to feel during a physical exam or detect on standard imaging until they've grown significantly. Second, there's no early screening test. Unlike mammograms for breast cancer or colonoscopies for colon cancer, there's no routine test for healthy people to catch pancreatic cancer early. Third, symptoms mimic common issues. Early signs, like mild stomach discomfort, bloating, or fatigue, are often mistaken for indigestion, aging, or stress, causing dangerous delays in seeking medical attention. Fourth, it spreads fast. Pancreatic cancer cells can invade nearby blood vessels and organs quickly, often before any pain even develops. Finally, by the time it's caught, roughly 50% of cases have already spread to distant parts of the body. This combination, hidden location, no screening, vague symptoms, and rapid spread, is exactly why timing and awareness become your most powerful weapons. Let's start with the very first warning sign, and it's one that catches almost everyone off guard: unexplained weight loss. Now, I know what you're thinking. Dr. Lee, losing weight sounds like a good thing. But when weight drops rapidly without any change in your diet or exercise routine, that's your body sending you a red flag, not a reward. Here's what's actually happening inside your body. When pancreatic cancer develops, it interferes with the pancreas's ability to produce digestive enzymes. These enzymes are essential for breaking down fats, proteins, and carbohydrates. Without enough of them, your body simply cannot absorb the nutrients from the food you eat, no matter how much you're consuming. This condition is called malabsorption, and it's one of the earliest metabolic disruptions caused by pancreatic tumors. On top of that, cancer cells are incredibly demanding. They consume enormous amounts of energy just to grow and multiply, essentially stealing calories directly from your body's reserves. This combination, poor nutrient absorption plus a tumor competing for energy, creates a perfect storm for sudden dramatic weight loss. Now, here's the number that should really get your attention. Studies show that up to 85% of pancreatic cancer patients experience significant, unintentional weight loss before they're ever diagnosed. We're talking about losing 10, 15, even 20 pounds within just a few months, without dieting, without increasing physical activity, without any obvious explanation. Many patients recall the same story in their own words. I was eating normally, sometimes even more than usual, but the weight just kept falling off. This is drastically different from healthy weight loss, which happens gradually and is usually explained by lifestyle changes. So, here's my advice, especially if you're over 60. If you notice you've lost more than 5% of your body weight within 6 months, and you haven't changed your eating or exercise habits, please don't brush it off as just aging or stress. Talk to your doctor. Ask specifically about pancreatic function. This single symptom, taken seriously and early, has led to earlier diagnoses and better outcomes for countless patients. Your body is talking to you. The question is, are you listening? The second major warning sign is one that's often dismissed for months, sometimes even years, before anyone connects the dots. Persistent abdominal and back pain. And I want to be very specific here, because not all stomach pain is a red flag, but there's a particular pattern you need to know about. Here's why this happens. As a tumor grows in the pancreas, it can press against surrounding nerves, particularly a network of nerves located behind the abdomen called the celiac plexus. This nerve cluster is deeply connected to sensations in your back. That's exactly why so many pancreatic cancer patients describe pain that starts in the upper abdomen or stomach area and then radiates straight through to the middle or upper back, almost like it's boring through your body from front to back. There's another important clue: timing. Many patients report that this pain gets noticeably worse after eating, especially after meals high in fat, and also tends to intensify when lying flat at night. In fact, some people find temporary relief by leaning forward or curling into a fetal position, a posture that reduces pressure on those affected nerves. If you or someone you love has been sleeping propped up on pillows just to ease unexplained back pain, that's worth paying attention to. Now, I want to be clear. This doesn't mean every backache or stomach ache is cancer. Most of the time, it isn't. Back pain is incredibly common as we age, often from arthritis, muscle strain, or spinal issues. That's exactly why this symptom gets missed so often. It's easy to blame it on getting older or an old sports injury. But here's the difference. Pancreatic-related pain tends to be persistent, doesn't improve with usual treatments like heating pads, over-the-counter pain relievers, or physical therapy. And it often gradually worsens over weeks rather than coming and going. Studies suggest around 70% of pancreatic cancer patients experience abdominal pain, and about half of those also report back pain as part of the same pattern. When these two symptoms show up together, especially combined with other signs we're discussing today, it becomes a much stronger signal that something deeper may be going on. My advice: if you're over 60 and dealing with abdominal pain that radiates to your back, doesn't respond to normal treatments, and has lasted more than 2 to 3 weeks, don't just push through it. Mention this specific pattern to your doctor. Front to back radiating pain, worse after eating, worse lying down. That level of detail can make all the difference in getting the right tests ordered early. The third warning sign is often the one that finally pushes people to see a doctor, because unlike the others, it's visible. It's called jaundice, and it shows up as a yellowing of the skin and, most noticeably, the whites of your eyes. Let me explain exactly why this happens, because understanding the mechanism makes it much easier to recognize. Your liver produces a fluid called bile, which travels through a small tube called the bile duct, down into your small intestine, where it helps digest fats. But here's the critical detail. The pancreas sits right next to this bile duct. When a tumor forms in the head of the pancreas, which is actually the most common location for pancreatic tumors, it can press against and block that duct. When bile can't flow properly, a yellow pigment called bilirubin builds up in your bloodstream instead of being processed normally. That buildup is what causes the yellow discoloration you see in the skin and eyes. But jaundice rarely travels alone. Pay close attention to these accompanying signs, because together they paint a much clearer picture. Your urine may turn noticeably dark, almost like the color of tea or cola. Your stool may become pale, clay-colored, or greasy-looking. This happens because bile, which normally gives stool its brown color, isn't reaching the intestines properly. Many people also experience intense itching all over the body, caused by bile salts accumulating under the skin, and often, jaundice is accompanied by unusual fatigue that doesn't improve with rest. Here's a critical point I want every person over 60 watching this to remember. Jaundice caused by pancreatic issues is typically painless in its earliest stages. This is very different from jaundice caused by gallstones, which usually comes with sharp, sudden abdominal pain. Painless jaundice is actually considered one of the strongest red flag symptoms doctors look for, because it's much more specifically associated with a blockage from a tumor rather than other common liver or gallbladder problems. Research shows that jaundice is present in over 50% of pancreatic cancer cases at the time of diagnosis, particularly when the tumor is located in the head of the pancreas. And here's the important silver lining. Because jaundice is so visibly obvious, it often leads to faster diagnosis compared to the other, more subtle symptoms we've discussed. So my advice is simple. If you or a loved one over 60 notices yellowing of the skin or eyes, darker urine, pale stools, or unexplained itching, even without any pain, please don't wait. See a doctor immediately. This is one instance where visible symptoms can actually work in your favor if you act on them quickly. The fourth warning sign is one that's incredibly easy to dismiss because it overlaps with so many common conditions we associate with getting older: digestive changes and a sudden loss of appetite. Let's break down what's actually happening inside the body. Remember, your pancreas produces essential digestive enzymes that break down fats, proteins, and carbohydrates in your small intestine. When a tumor disrupts normal pancreatic function, enzyme production drops significantly. Without enough enzymes, fat in particular becomes very difficult to digest properly. This leads to a specific and telling symptom: staturia, stool that becomes greasy, foul-smelling, floats in the toilet, and is difficult to flush. If you've noticed this change and brushed it off as something I ate, it's worth paying closer attention if it becomes a repeated pattern rather than a one-time occurrence. Alongside digestive changes, many patients report a dramatic and sudden loss of appetite, not just eating a little less, but actually losing interest in food altogether, sometimes feeling full after just a few bites, a symptom doctors call early satiety. This happens partly because the tumor can press against the stomach and nearby digestive structures, and partly due to complex hormonal and inflammatory changes that cancer triggers throughout the body, which directly suppress hunger signals in the brain. Other digestive symptoms commonly reported alongside this include persistent nausea, occasional vomiting, new-onset bloating after meals, and general discomfort after eating that wasn't there before. Individually, these symptoms seem minor, the kind of thing many people over 60 might attribute to a sensitive stomach, acid reflux, or simply getting older. But when several of these changes appear together and persist for weeks without an obvious cause, that combination becomes far more significant. Here's a statistic worth remembering. Studies show that roughly 65% of pancreatic cancer patients report noticeable appetite loss, and a similar percentage experience some form of digestive disturbance in the months leading up to diagnosis. These symptoms often appear well before pain or jaundice develop, making them some of the earliest and most frequently ignored clues your body can give you. My advice here is straightforward. If you've noticed a genuine, unexplained loss of interest in food, combined with digestive changes like greasy stools, persistent bloating, or nausea that has lasted more than a few weeks, don't simply adjust your diet and hope it resolves on its own. Bring these specific details to your doctor. Mentioning appetite loss alongside digestive changes, rather than describing them separately, can help your doctor connect the dots much faster. The fifth warning sign is one that surprises even many doctors because it's counterintuitive, and it's often the most overlooked clue of all: sudden, new-onset diabetes after age 60. Here's why this connection matters so much. Remember, your pancreas doesn't just aid digestion, it also produces insulin, the hormone responsible for regulating your blood sugar. When a tumor develops in the pancreas, it can directly damage the insulin-producing cells, or it can release certain substances that interfere with how your body responds to insulin. Either way, the result is the same. Your blood sugar levels rise, sometimes very suddenly, leading to a diabetes diagnosis that seemingly comes out of nowhere. Now here's what makes this so different from typical type 2 diabetes. Most cases of type 2 diabetes develop gradually over many years, often connected to weight gain, family history, or long-term lifestyle factors. But diabetes linked to pancreatic cancer tends to appear suddenly, in someone with no prior risk factors, often alongside unexplained weight loss, which is actually the opposite of what typically happens with regular type 2 diabetes, where weight gain is more common. This connection is backed by real research. Studies show that nearly 50% of pancreatic cancer patients are diagnosed with diabetes within just 2 to 3 years before their cancer diagnosis. In fact, doctors now consider new-onset diabetes after age 60, especially when it's not associated with obesity or a family history of diabetes, as a potential early warning sign that deserves further investigation, not just a standard diabetes treatment plan. There's a term for this in the medical community. Some researchers call it type 3C diabetes, or pancreatogenic diabetes, specifically referring to diabetes caused by underlying pancreatic disease rather than the typical lifestyle-related type 2 diabetes we're all familiar with. So here's my advice, and I consider this one of the most important points in this entire video. If you or someone you love is diagnosed with diabetes after the age of 60, especially without significant weight gain, without a family history of diabetes, and particularly if it's accompanied by any of the other symptoms we've discussed today, unexplained weight loss, digestive changes, or abdominal pain, please ask your doctor directly. Could this possibly be related to my pancreas? That single question, asked at the right time, has led to earlier detection in real documented cases. Don't assume new diabetes is just diabetes. Sometimes it's your body's earliest possible warning sign. Beyond the 5 major signs, there are subtler clues worth knowing. Sudden onset of severe depression or anxiety with no clear life trigger has been linked to pancreatic cancer in several studies, possibly due to biochemical changes the tumor causes in the body. Unexplained fatigue that doesn't improve with rest or sleep is another overlooked sign, often dismissed as normal aging. Blood clots, particularly in the legs, appearing without obvious cause can also sometimes be an early indicator. None of these alone confirm cancer, but combined with other symptoms we've covered, they add important pieces to the puzzle your doctor needs to see the full picture. Certain factors sharply raise your risk after 60. Long-term smoking increases risk nearly 2 to 3-fold. Chronic pancreatitis, obesity, type 2 diabetes, a diet high in processed red meat, and family history of pancreatic or related cancers like BRCA-linked breast cancer. If 2 or more apply to you, extra vigilance matters. Let me share a real story. Margaret, 67, felt fine. Just mild back pain she blamed on gardening, and unexpected 12-pound weight loss she credited to finally eating healthier. 6 weeks later, new diabetes appeared. Her doctor, noticing this unusual combination, ordered an abdominal scan. The result: early-stage pancreatic cancer, caught before major spread. Margaret later said, "I ignored every sign individually. Together, they saved my life." Her story isn't rare. It's a pattern doctors see repeatedly, proving that connecting subtle symptoms, not waiting for pain, is what truly saves lives. Before we continue, if this information feels valuable, hit subscribe now, because next, I'll reveal the exact tests doctors use to catch pancreatic cancer early, plus simple lifestyle changes that can genuinely lower your risk. Stay with me, this next part matters just as much. So, when should you actually see a doctor, and what tests should you expect? If you notice 2 or more symptoms we've discussed lasting beyond 2 to 3 weeks, book an appointment. Doctors typically start with blood tests, including one called CA19-9, a tumor marker often elevated in pancreatic cancer. Next comes imaging. A CT scan or MRI can visualize the pancreas clearly. If something suspicious appears, an endoscopic ultrasound or EUS allows doctors to get an extremely close look and even take a biopsy sample. Don't wait for all symptoms to appear together. Early testing, even if it turns out to be nothing serious, is always worth the peace of mind and potential life-saving outcome. Now, let's talk about what you can actually control, because while genetics play a role, lifestyle choices significantly influence your risk, especially after 60. First, quit smoking, or if you've already quit, celebrate that decision. Smoking remains the single largest controllable risk factor, responsible for roughly 25% of all pancreatic cancer cases. Even after decades of smoking, quitting still reduces risk over time. Second, watch your diet closely. Diets high in processed meats, fried foods, and refined sugar have been linked to increased risk, while diets rich in vegetables, fruits, whole grains, and lean proteins, particularly ones similar to the Mediterranean diet, are associated with lower risk. I always recommend incorporating antioxidant-rich foods like berries, leafy greens, and turmeric, which have anti-inflammatory properties. Third, manage your weight and blood sugar. Since obesity and type 2 diabetes are both linked to higher risk, maintaining a healthy weight through regular movement, even simple daily walking, makes a meaningful difference. Fourth, limit alcohol consumption, as heavy long-term drinking is associated with chronic pancreatitis, which itself raises pancreatic cancer risk. Fifth, know your family history. If close relatives have had pancreatic, breast, or ovarian cancer, especially with BRCA gene mutations, talk to your doctor about genetic counseling and potential early screening options. None of these changes guarantee prevention, but together, they meaningfully shift the odds in your favor. Combining reduced risk with the early symptom awareness we discussed earlier gives you the strongest possible defense. If you're over 60, please don't wait for pain to tell you something's wrong. By then, it's often already advanced. Unexplained weight loss, digestive changes, new diabetes, back pain, or jaundice. These are your body's early whispers, not silent secrets. Listen to them. Talk to your doctor even if you're unsure it's serious enough. Awareness truly is your first line of defense against this disease. If this video helped you, share it with someone over 60 you love. It could genuinely save their life. I'm Dr. William Lee, reminding you, your health is in your hands. Take care of yourselves.